When an obstructed airway cuts off oxygen, the human brain begins to suffer irreversible damage in exactly 4 minutes. If an emergency happens on your factory floor, the clock is already running. Every passing second of hesitation works against your colleague's survival. This creates two immediate problems: a medical crisis on the ground and an immediate risk of non-compliance with the OHS Act. Most untrained bystanders completely freeze in these moments. They panic, fearing that stepping in might worsen the injury or lead to a lawsuit. This paralysis costs lives and leaves the organization vulnerable to legal liability and failed safety audits. This diagram illustrates the definitive protocol for breaking that paralysis, the 3 Ps of first aid. Mastering these 3 pillars provides the steps needed to take control of a chaotic scene while maintaining strict workplace compliance. Effective emergency response does not require spontaneous heroism. It requires executing a rigid, legally sound set of rules. The foundation of this protocol is the first pillar: preserve life. This rule comes with a specific requirement. Preserving life always starts with the responder's safety, not the patient's. Running into a hazardous environment, like a chemical spill or live electrical zone, means you have failed this first objective. You have simply added a second patient to a critical scene. The first physical action you take is to put on personal protective equipment. Using disposable waterproof gloves and a CPR pocket mask prevents cross-infection. Once protected, you move to the primary assessment. This flowchart maps the 3 most vital human systems, the ABCs: airway, breathing, and circulation. If any of these systems fail, you intervene immediately. A blocked airway or bleed requires life-saving treatments like CPR or direct pressure. Intervening in the ABCs buys critical time. However, those efforts are ineffective if the surrounding environment is still actively threatening the patient. This leads to the second pillar: prevent further injury. To secure the physical scene, you must identify every hazard using the HHH framework: hazards, hello, help. Under the hazards step, there is a strict constraint. You must never move a patient unless there is an immediate, uncontrollable environmental threat. Moving a patient unnecessarily carries severe risks. It can turn an undetected spinal issue into permanent, debilitating damage. Once the area is physically locked down, you move to the hello phase. You introduce yourself to the patient, state your intent to help, and get their consent. This introduction serves a physiological purpose. Clear reassurance can lower the patient's heart rate and stabilize their breathing. By reducing physiological stress, this verbal reassurance helps prevent the onset of shock while you wait for professional help. The third pillar is promote recovery, and it defines the limits of your role. First aiders are not doctors. You must never attempt to diagnose medical conditions or administer any type of prescription medication. Your objective is to keep the patient comfortable, stabilize fractures, and reduce pain, which actively aids the recovery process. Next is mobilization. You assign a specific bystander to call the South African National Emergency Medical Services at 10177 or the police at 10111. While waiting for the ambulance, you conduct a secondary assessment. This diagram maps the data points you need to monitor to locate hidden injuries. You must monitor vital signs and pupil responses, keeping accurate written records of the patient's condition throughout. This written record serves as the responder's primary shield against future legal liability and secures the incident's chain of custody. When the paramedics arrive, your responsibility shifts to the transfer of information. You must execute a structured handover. This graphic shows the transfer of critical data: patient demographics, mechanism of injury, suspected injuries, and exact treatment times. Communicating the exact mechanism of injury is crucial, allowing the EMS team to apply life-saving medical responses immediately. This handover represents the official transfer of the chain of custody, moving legal and medical responsibility to the professional team. Exceeding your scope of work, performing treatments you are not qualified for, breaks this chain and invalidates your legal protections. Operating within these boundaries and following the 3 Ps ensures your organization remains audit-ready and your colleagues remain protected.